I'm here to talk about a CGI commitment called Together for Girls. Together for Girls, I'll explain in a moment what we do, but the objective is to end violence against children, particularly sexual violence against girls. In fact, that was our sole focus at the point of our founding. And there's three things I'd like you to take away from, this brief 5 minutes. First, I just want to underscore the CGI commitment process really does work. Together for Girls is living proof of that. And as I speak about what we've been able to accomplish since our launch in 2009, I think you'll see that CGI provides a foundation and a platform for things that can have global impact really take hold. This commitment process works. The second is it's possible to take on one of the world's most challenging issues, sexual violence against girls, and make significant progress in a relatively short period of time. And the third is that when you can get the business sector, governments, and the UN agencies and other agencies working together in collaboration, you can accomplish some very substantial things that no one agency or government or sector, including the private sector, could accomplish on its own. So let me just start with this slide. This is our humble beginnings. This was the first meeting of the Together for Girls partners. It occurred at CGI's offices in May 2009. The program hadn't even been officially launched yet. CGI did a lot for us, and they hosted our first meetings. This was started from the ground up. I've spent over 30 years working in the private sector. I didn't have any background in this issue, but I became quite passionate about it, working for a decade on HIV and AIDS, particularly in sub-Saharan Africa, and understanding that sexual violence against girls was one of the primary factors underpinning continued spread of the disease among youth. And so we started this from ground up. CGI actually lent one of their staff members, who became my right-hand person for the first 2 years. I actually ran this for the first 2 years in addition to the day job. And then, as I'll speak about in a moment, we recruited somebody much more capable to run it. But without CGI, this would not have gotten off the ground. This picture is from the actual launch. President Clinton himself launched this at the end of the 2009 meeting, September 2009 annual meeting. I can tell you that gave us a huge jolt of momentum. People refer to it as the Clinton Sexual Violence Initiative. I had to keep telling them that CGI has certain rules. You don't call it a CGI initiative. It is the CGI commitment. Be that as it may, it worked because we had lots of leaders. I mean, you can see here, and I have a great network, I have to say that. So I had relationships with most of the heads of the UN agencies and U.S. agencies, and they knew I was working for about 2 years seeking to mobilize this. And once a methodology was identified, and that methodology was identified through associations I have with the CDC and UNICEF. I sat on boards for both organizations, and they had been doing some initial work in Swaziland. That became the means to mobilize. Once we had that, we were able to move quickly and get the leaders of these agencies up on the stage for the initial announcement. Now, that methodology itself has 3 pillars, and this was put together prior to our launch. The first, and I'm coming back to the data, we do national house-to-house surveys documenting the magnitude and impact of physical, emotional, and sexual violence against children. It started just with girls, then we added boys. In a moment, you'll understand why that was important. We interview children aged 13 to young adults aged 24 about their experiences with violence as children. This is done outside of the presence of their parents, otherwise you would not get accurate information. It's done under the auspices of a health survey, and it's been vetted by every standards body, IRBs, World Health Organization. This is being done by the best data collectors in the world. That leads to the second pillar, which is a government-led, multi-sectoral action plan. All these initiatives in countries are implemented under the leadership of the national government. Without the national government's leadership, we wouldn't do it. And that involves changes in laws and law enforcement, community-based prevention programs, and services for children who experience violence, including services on the spot if, in fact, the process of being interviewed triggers a memory and they need immediate support. And we work across multiple government sectors. This is truly a collaborative effort, not only on a global level, but on a country level. And we also engage in global awareness and advocacy. And I have to say, Together for Girls has done a lot of work to get this on the national stage and international stage. It's a much more visible issue today as a result of our work. Now, I mentioned to you in 2009 when we started, we were only working in one country, Swaziland, that actually predated the formation of Together for Girls. I'm very proud to say that today, 6 years later, we're implementing Together for Girls in 17 countries in sub-Saharan Africa, Asia, Latin America, and the Caribbean, all under the leadership of the national governments. And there would be more if we had more resources, because the demand to do this, once governments understand that the combination of data and support from the UN system, and I'll talk in a moment about our partners, they actually want to take this issue on. They know this is a major problem. So we've expanded much more rapidly than I would have thought was possible when we launched in September 2009. And we've mobilized over $70 million in funding through our partners. We have a small secretariat in Washington, D.C., run very, very efficiently, that oversees and coordinates all these actions, and we implement through our partners. And speaking of our partners, they include 5 UN agencies, with UNICEF as the lead among them. The U.S. government, with CDC as the lead, with funding from PEPFAR. The government of Canada joined as a partner more recently. Several private sector organizations that are also CGI members, the Naduna Foundation, Grupo ABC, and the company I work for, Becton Dickinson. In fact, I'm very pleased to say just this week, Becton Dickinson approved another $600,000 of funding for Together for Girls. So I'm going to share a little bit of information with you about the data that's been generated by Together for Girls. We just have a few moments. If you go to the website, togetherforgirls.org, it's just one word, togetherforgirls.org, you'll be impressed, because we now have data representing 11% of the world's population under age 25 in their experiences with violence and sexual violence, and that number will continue to grow. So just to give you a small taste of the data, first, over half of all children have experienced physical violence. This is beyond an epidemic. This is a pandemic. And we have data indicating that boys who are exposed to violence in childhood are more than twice as likely to become perpetrators of violence as adults. This is what made it so important that we included boys, among other reasons, because as victims, it continues the cycle of perpetration. This I find to be a startling statistic, a sad statistic. In every country polled, the first sexual intercourse for girls, more than 1 in 4 girls, was unwanted. So if you think about forced intercourse, the equivalent basically of rape, more than 1 in 4 girls experienced that. And what makes that even worse is that 1 in 3 girls who experienced forced intercourse had an unintended pregnancy as a result. This is data coming out of the countries. So think about what happens when a young girl, 14, 15-year-old, not only experiences forced intercourse, but then has a pregnancy. Whether she tries to end that pregnancy or whether it continues, her life has taken a devastating negative turn, and she'll need a lot of help to recover from that negative turn. But it's not just this. Take a close look at the data here. Sexual violence against girls drives a multitude of negative health conditions, substantially increased risk of contracting HIV and other sexually transmitted diseases. Maternal mortality and morbidities, I don't think I have to tell this group that if a 14-year-old girl becomes pregnant, she has a 5 times higher likelihood of dying in childbirth compared to a woman 20 and older. And then a whole range of chronic conditions, alcohol and substance abuse, depression, thoughts of suicide, and attempts at suicide. And to share more sad news, suicide is now the leading cause of death among adolescent girls. This is one of the factors. Think about what the world is investing to address these problems. Billions and billions of dollars to address these problems. So in that context, we're just investing a small fraction to deal with the underlying causes. The other sad fact is these problems stay in the shadows. They're not out in the open. That's part of what Together for Girls has done, is brought it out of the shadows. Because in most places, if a girl reports, she's further victimized. So we actually have data on reporting and accessing services, and the percentages. The numbers are shockingly low, not surprisingly, but sadly so low in terms of services that are available. So this is what we're trying to address. So this is clearly devastating to the lives of girls, and as far as I think all of us are concerned, this is simply unacceptable. We can't, this is why we formed Together for Girls, this is why I stepped out of a day job in the private sector and devoted a lot of time to launching this. You just can't sit back and understand this is happening and not do something about it. But there's also a positive story to tell, and I'm going to start with these 2 nice words, happiness and grace, but they're not just 2 nice words. They happen to be 2 very nice people. They're 2 senior well, let's just get the side change. We'll see the pictures of happiness and grace. There we go. They're, now, I have to admit, I don't know the name of the 3rd person here, but I do know happiness and grace. They're police officers in Tanzania who exemplify the effective actions that governments are taking to respond to sexual violence and violence against children. They're specially trained to support children who've been abused. They're really the heroes on the front lines of this work. The government of Tanzania is sort of the best case example for what's happening now. They've used data from their Violence Against Children survey as a basis of a very comprehensive national plan of action supported by Together for Girls and its partners. An important element of this plan is they deploy teams of professionals from the justice, social welfare, health, and education sectors to identify and respond to abuse. So CGI asked me to comment on barriers, and I have to say one barrier was when I first came up with this idea and was starting to share it with people, they thought I had lost my mind. They said someone with no background in gender-based violence is going to take on an issue that's nearly impossible, and you're going to get 5 UN agencies working together with the US government and other governments. Why would you bother to take this on? But what I found was quite a different experience, that having so much experience in the private sector, and you learn to do things like professional meeting facilitation and running things efficiently, and being sort of an outside person coming in actually made it easier to get agencies that otherwise maybe didn't work so much together to coordinate. So it didn't end up becoming a barrier, it actually became an enabler. And what I found to be, as a lesson learned, the most effective things were sheer persistence and a deep devotion to this cause among all the partners. There was no question what we were there together to do. There were no hidden motivations. There was no ego coming in. All of us were driven by a common, very strong underlying motivation to address this issue. That plus persistence enabled us to overcome barriers. But I have to say also, it was supercharged by the people we have working on this. And they're not up here with me. I wish they were. But Child Protection Section at UNICEF, an amazing team that's really taking the lead on a lot of the work most of the work going on in countries. The Division of Violence Prevention at the CDC, which are the most informed violence prevention professionals. The data that they're able to gather, just phenomenal. The U.S. Office of the Global AIDS Coordinator, I ran into Eric Gooseby today just on 3rd Avenue coming from the UN. You know, I always give him a hug because he's such a phenomenal person. He made a $5 million commitment and got PEPFAR to support this, and also enabled us to bring in the person I'll mention next as our director for Together for Girls. I'm indebted to Eric for what he's done. And then Michelle Maloney-Kiss, who's sitting right here. Michelle, please, just for a second, stand. I know that's off script, but Michelle runs Together for Girls. She was deputy at PEPFAR for a decade. She was one of the people who made PEPFAR what it is today, one of the key leaders, working under its first 3 leaders. She transitioned in 2011, has just done amazing work leading Together for Girls. Milan Verveer, by the way, one of our partners from the beginning. I was disappointed when she stepped out, but Milan knows how much we appreciate what she's done for us. So this is what's enabled our progress. Our ongoing progress at this point, I'd say, is limited primarily by the amount of resources currently available to address this problem. This problem affects every country in the world. We're in 17 countries, but this problem exists everywhere: U.S., Canada, developed countries, emerging countries, developing countries. And I want to close by emphasizing how important it is to focus on girls. You know, a lot of times I'll hear violence against women, and it's extremely important, of course. It's a very similar issue, but I always, CGI will tell you this, Renee will tell you this, guy said, don't just say violence against women. You have to also call out girls specifically, because around 50% of all sexual assaults are committed against girls 15 and younger. And we have, part of changing societal norm is not to refer to a girl as a woman. Because once you call a girl a woman, she's 14, you call her a woman, in many places in the world, that means she's ready. You know, she's ready to be sexually assaulted. Not that a woman or a girl should be sexually assaulted, but at that age, they have very little defense to protect themselves. They're very, very vulnerable, particularly vulnerable to being raped. And on a population level, as you saw, this issue of sexual violence against girls underpins many of the most deeply embedded health and human rights issues the world needs to address. But that didn't stop us from making this commitment. That didn't stop us from making progress, expanding to 17 countries. Many more are eager to take this on, and I hope this update, this progress report, convinces you CGI commitments work, but also if you have any interest in supporting this essential work, we would definitely welcome that support. Thank you.